Hello, this is Dr. Hesham El-Dabbah. Today I'm going to discuss with you an important topic in psychiatry, which is psychotherapy. So, when we start treatment in psychiatry, we always think of three important modalities when we are thinking from biopsychosocial approach. So first, treatment is medical treatment using medication and pharmacotherapies, things like antidepressants and psychotics, mood stabilizer, and benzodiazepines. Other important modality is psychological therapies or psychotherapy. And the third and important approach is social approach, involvement of social service. So the topic of this lecture will focus on psychotherapy. So what's psychotherapy? It's a general term that we use to describe using psychological theories to treat mental health disorders using talking with the patient. It's also known as talking therapy, psychological therapy, counseling, psychosocial therapy. So, psychotherapy is based on therapeutic relationship between the patient and the therapist. It's based on dialogue, based on talking. So, in psychotherapy, we provide a safe and open space for the patient to express himself without fear of judgment, without fear of breaching confidentiality. And then talking with them and through the safe relationship, we help them understand themselves better, to understand their patterns of emotions, behaviors, and help them to gain control of their thinking and emotional behavior patterns. So one important question is who can provide psychotherapy? Different mental health professionals can provide psychotherapy as long as they are trained in the psychotherapeutic schools and have clinical supervision. So in Egypt, psychiatrists and psychologists are licensed to provide psychotherapy. But the multidisciplinary team of mental health professionals who can provide psychotherapy can be further extended to include psychiatric nurse and licensed social workers and marriage and family therapists. So how did psychotherapy develop? So I think most of you have heard of Sigmund Freud, is famous German psychoanalyst. He was originally a neurologist, and in the late 19th century, he was a neurologist who was studying under the French neurologist Jean-Martin Charcot, and he was studying cases of hysteria or functional neurological disorders where patients will develop with medically unexplained neurological symptoms after experiencing psychological distress. And he used hypnosis early to help patients to relieve from what was called hysterical paralysis. And he found that when people discussed and relived their earlier stressful life experience, this was association with the conflict resolution and the relief of their symptomatic presentation. So when unconscious conflicts are brought into conscious during the hypnotic state, patients usually get improved. Then, as he developed psychoanalysis, he found two important techniques that help them with accessing the unconscious. Pre-association, so you know the famous image of people lying on a couch and just talking, and a psychotherapist is sitting by his bedside and taking notes. So people will just talk freely, and as they talk, they can get access to their unconscious. And the therapist will listen to him and try to analyze what's going on. The other way was dream interpretation. So dreams, according to Freud, were the golden gate to the unconscious, and through analyzing and interpreting dreams, he could gain access to unconscious conflicts and help the patient resolve it. And these were the basis of what's called psychoanalysis. So one important question is, does psychotherapy work? So most people who undergo psychotherapy benefit from some relief in their symptoms, and they are able to function better in their life. Up to 75% show some benefits. So the benefits can be that it helps them with improving their emotions and behaviors, but also it has another effect that's improving their relationships, their work performance. They have fewer sick days, less disabilities. But it's actually much more than that. So when we say that psychotherapy is talking therapy, it doesn't mean that it's not a true therapy. It's actually a biological therapy that have real effect on the biology of the neural circuits of the brain. And multiple functional imaging studies has been done and shown the effect of different modalities of talking therapy on the brain in different disorders, including depression, PTSD, and anxiety, personality disorders. So, for example, in depression, imaging shows that there is an increase in the size of hippocampus after course of CBT, which are similar to the changes that happen with medication. So talking therapy are an actual biological therapy. It's not just some talk that with someone like your friend or your family. So what are the different formats of psychotherapy? It has four main formats, can happen in individual formatting or group formatting or family or couple. And the format differs, and it depends on the modality of therapy, the patient characteristic, and the style of the therapist. So individual therapy is the most common format. Usually it's therapist and the patient. They are one-to-one in the clinic. This type of therapy provides a better therapeutic relationship. They can focus on understanding each other more, improving the therapeutic relationship. And usually it's helpful for patients who are too anxious to engage in a group therapy. It's the most common type of therapy format, and it helps lots of patients. Second most common is group therapy. So in group therapy, patients sit in group with a therapist and co-therapist. And usually the groups can be homogeneous, where all the group members share a common diagnosis or problem, or can be heterogeneous. Group therapy provide an important medium for patients to know that they are not the only one who suffers, there are other people who share their suffering. This provides them with good access to skills training, improving their communication. And it has some rules, so there's confidentiality of the group is very important. What's discussed in the group is not shared outside the group, and people have to listen and respect each other. Group therapy can be used for skills training, can be used as a type of psychodynamic therapy, or can be used in other modalities like cognitive behavioral therapy. The other common modality is for mating is couple therapy. So usually in couple therapy, couples sit with a therapist and they discuss their relationship. And it can be used to either improve communication in healthy relationships, or it can help with conflict resolutions with couples facing separation or divorce. So usually they discuss the relationship, understand better way of communication, how to express their emotion better, how to negotiate conflicts. And it can also be used in other uh, indications, like, for example, couple therapy or addiction, where using the support of the partner, it can help the addict during couple therapy. The final format is family therapy, where the whole family can attend the therapy session with the therapist. And it can be used either as part of counseling, for example, in counseling, family counseling for separation or divorce, or for child counseling, or can be used, for example, for schizophrenia, in early schizophrenia to reduce the risk of relapse, or in some disorders in adolescents like eating disorders. So as a family, the family as a unit share their way of communication and how as a system each member can be a subunit of the system, and their way of communication can be perceived with different intention from the other members, and this can affect the family dynamic. So that's the four main formats of family therapy. Usually, therapy sessions can last around 45 to 50 minutes long in most of individual sessions. Family therapy can last up 2.5 hours with a break in between. Uh, the duration of therapy varies, so it can be short term for 3 to 4 months, like in CBT, or can be 1 or 2 years in more complex issues like personality disorders. Can be used for children, adolescents, and adults. And usually we can use talking therapy on its own in mild and moderate disorders, but when it's moderate or severe, it's better to combine it with medication. And it varies from one disorder to another. So psychotherapy, as I told you, the therapists need to be trained in a psychotherapeutic schools, and there is dozens of schools of talking therapy. But these are the six more common types. Psychodynamic school, based on the psychoanalytic theories of Freud and later psychoanalysts, cognitive behavioral therapy, based on the work of Aaron Beck, dialectical behavioral therapy, which is based on the work of Marshall and interpersonal therapy, humanistic therapy, with its with most famous humanistic psychologist Carl Rogers, and supportive psychotherapy. So let us go through them in short. So psychodynamic therapy is a type of talking therapy which is based on the ideas of Sigmund Freud, psychoanalysis. So it's based that our behavior and thoughts and emotional patterns are influenced by our childhood experience, and they are repeated through in unconscious patterns. And in psychodynamic therapies, patients work with the therapist to get better understanding and insights of their patterns. How did they develop? How did they come? Where did they come from? And how to work to change them. So psychoanalysis is a more intensive form of psychodynamic therapy. It's So psychodynamic psychotherapy can be done once weekly, but psychoanalysis is usually done 3 or 4 sessions a week, and it can be done over years. Cognitive behavioral therapy is the most common type and most evidence talking therapy used nowadays. So it's based on the idea that our emotions are influenced by our thoughts, and both can affect our behavioral patterns. So CBT help people identify their underlying thinking patterns and how they can be unrealistic and dysfunctional. And then we can help the patients how to replace them with more realistic and functional way of thinking. We can also help them with some behavioral techniques like relaxation techniques, and communication skills, and problem solving. It's the most common evidence-based therapy. It can be used for treatment of depression and anxiety, trauma, and eating disorders. Dialectical behavioral therapy is a third wave CBT therapy. It was developed by Marshall and Hen, usually for people with borderline personality disorders and highly suicidal patients. Now it can be used also for major depressive disorder, eating disorders, and PTSD. So dialectical behavioral therapy doesn't focus only on change like CBT, but there is a balance between accepting negative emotion, accepting negative situation, accepting the patient and its problem at one hand, and the other hand, developing skills for change. There are 4 core skills, which are mindfulness, interpersonal effectiveness, distress tolerance, and emotional regulation. Usually, dialectical behavioral therapy involves 3 formats at the same time. So the patient attend group skills training with individual sessions at the same time for going through what's happened through the week and helping the patient to practice the skills that he learned during group therapy. And also it involves phone coaching in between the session. The patient can access the therapist on phone when he is in emergency situation for help. Interpersonal psychotherapy is another school of psychotherapy. It's short, structured psychotherapy. It's usually used to treat depression. The idea is that our psychological problems usually arise from interpersonal issues and interpersonal problems. So patients works with their therapist to identify their interpersonal problem areas, and it's usually one of 4. It can include interpersonal loss like grief, or interpersonal deficits like uh, uh, social isolation and lack of social support, or interpersonal conflicts like problems and interpersonal problems with significant others and our colleagues, or interpersonal rule change. For example, change in work, someone who works was then retired, someone who was single and then got married, or a married person got divorced. These rule changes can have an effect on the interpersonal function and can cause emotional problem. So therapists work with the patient to help him with his problems, help him with improving his interpersonal skills, communication, teach him communication skills, and they do some role plays to help them to relate to others in a better way. Humanistic therapy is another school of psychotherapy. It's based on the idea that people are usually good at heart and they can make the right choice for themselves. And it's based on the idea of unconditioned positive regard. So therapists need to see the patients that they are really good and they can achieve whatever they want. And we need to have unconditioned belief in their ability to do so and just help them to achieve their potential. This type of therapy was developed by Carl Rogers, the famous humanistic therapist, and he developed client-centered therapy. So in client-centered therapy, one important idea is the perceived sense of self. So people have a perceived sense of self which can be either too distant from their ideal sense of self, so it causes depression and disappointment, or it can be too distant for the real self. They can view themselves in a negative way, which is different and distant from the real self, and also this can cause disappointment and depression. So, through unconditioned positive regard and helping patients, we try to narrow the distance between their perceived sense of self and their true self from one side and their ideal self from the another side, ideal sense of self. The last type of talking therapy that we are going to discuss today is supportive psychotherapy. So usually in supportive psychotherapy, we work with patients to support them and encourage them to develop their own resources. Usually we use it to deal with issues related to their mental health, to increase their coping strategies, build their self-esteem, and improve their community function. There is additional type of therapy that can be used in combination with traditional psychotherapy, including play therapy for children, animal therapy, which can be used, for example, to people with autism and people with anxiety, and art therapies are different art therapies from dance to music to art, which also can help people to deal with their emotional problems. So what kind of mental health conditions that can be used to, that can be helped by psychotherapy? An anxiety disorder like OCD, PTSD, generalized anxiety, social anxiety, and panic disorders, mood disorders such as major depressive disorder, bipolar affective disorders, eating disorders such as anorexia nervosa and bulimia, substance use disorders, personality disorders, especially borderline personality, dependent personality. Also, psychotic disorder like schizophrenia can benefit from talking therapy. And as you go through these topics, the relevant talking therapy will be discussed in each lecture. But psychotherapy can not help not only with diagnosed psychiatric disorders, can help people who are not mental health patients, but it can help them to relieve their stress caused by any work stress, can improve their relationships with their partners, family. It can help them deal with major life events such as divorce, grief, loss of a job. It can help them with their trauma if they experience trauma such as physical, sexual abuse. They can help them in anger management and to help them to manage their aggressive behavior. It can help them in dealing with chronic health conditions like cancer or chronic pain, for example, acceptance of commitment therapy. We can also use, for example, CBT for people with insomnia. Usually, people with low self-esteem also can benefit from talking therapy. So talking therapy can be used not only for mental health patients with a diagnosed mental health disorder, but also most of people actually can benefit from one form or another of a talking therapy. And thank you. I hope that you have benefit from this lecture. If you have any question, feel free to contact me during your clinical round, and see you during throughout.